Uttar Pradesh in particular, the country's most populous state, larger than most European nations, and it is now one of the worst hit states. Uttar Pradesh has registered over 1.2 lakh fresh cases in just the last 4 days, with over 29,000 cases and 288 deaths in the last 24 hours alone. And the four-phase panchayat polls in the state elections of which took place in the last few days, over 700 teachers allegedly, according to the teachers union, have lost their lives in election duty, remember, in COVID time. So clearly Uttar Pradesh is a major crisis center. I want to go to Sidharth Nath Singh, Uttar Pradesh cabinet minister at this moment. Sidharth Nath Singh, Uttar Pradesh at all levels now seems to be a state vulnerable to COVID-19. We are getting reports every day of people in smaller districts of UP struggling for health infrastructure. In Saranpur, in the last 24 hours, several deaths have taken place, and the story is being repeated in district after district. What's the answer that you have when, for example, we are told that during panchayat elections, allegedly 700 teachers lost their lives?
Well, Rajdeep, my respectful condolences to those who have died in any election or in any other form of duty in Uttar Pradesh. But I will not go into the figures. Neither I would like to dispute them, because it's not the hour. But certainly, the expressions are, in my opinion, and what the government has, it's much higher. It's much lower. So, but anyway, it's not an issue. One death is good enough, and we must...
Sir, it may be lower. Sir, it may be 130, it may be... Sir, let's not go into figures. The fact is people have died. The fact is people have died while conducting panchayat elections because there was no social distancing. I mean, let's be clear. Priority is saving lives, not a panchayat election.
Rajdeep, if you wish to go into that direction, then somebody has to, or then the media, please question the Supreme Court on the counting. The Allahabad High Court, 2 PILs went. Allahabad High Court said no, the elections can be. So, why blame the government about it? So I don't think I'm here to question the courts. Neither the media is going to be questioning the court when they have given the decision and you went ahead with the elections. So it's not BJP alone or any other political party. It was the system and democracy. When elections are called, then everybody goes and jumps into it. So, but yes, the social distancing was an issue even today. When we realized that in Bijnor that people are not following the social distancing, so 14 people have been booked under not maintaining the social distancing, and they have not been booked, they have been taken to jail also. And even yesterday the same thing happened. It was a strict message to all the DMs and SPs in Uttar Pradesh in each district by CM. It was reviewed early in the morning, then again it was reviewed around 10:30. Then by afternoon we reviewed again. So things were being monitored. But you have raised a different question of the rural pandemic which can spread, and it's a very valid question. In not only the infrastructure, certainly infrastructure, and how do we manage it? I think I'm going to restrict myself to that. From 5th of May, we are going to be having a very aggressive campaign in 90,000 villages of Uttar Pradesh, which are existing villages of Uttar Pradesh. Now, what are we going to be doing there? What we are going to do before that, we have about 822 common community health centers in the rural part of Uttar Pradesh, and each community health center we are giving 20 oxygen concentrators. We are also arranged 10 lakh medical kits for those who are COVID positive, which will be distributed. We have Nigrani Samitis. Now, this is something similar to what we had done to fight AES and JE, which is now almost eradicated from Uttar Pradesh, a Dastak Abhiyan. So these Nigrani Samitis, which are more than 70,000, they will be going door to door and not only awareness, but also finding out if there are any patients, so they will be isolated immediately. If they don't have their own isolation, if they have to be isolated, they will be brought to schools where we have made the isolation arrangement, or ITIs and all these institutions. So in the villages, and if they require to be immediately taken for oxygen, then it is what we are doing, the concentrators, as I mentioned, in the CHC. And if they are L2, L3 patient, obviously they will be moved into the city areas. So this we have made arrangement. Not only that, we make it more aggressive.
I'm glad to hear all this. No, Mr. Sidharth Nath Singh. Mr. Sidharth Nath Singh, I'm glad to hear all this, because till the other day, the UP government was not even acknowledging that there was an oxygen crisis. It required a series of stories on Aaj Tak, India Today and other media to accept that there was an oxygen crisis problem. Till the other day, you were not even. So I'm glad to know that you are acknowledging now that there is a crisis in UP. Because till the other day, you were not even accepting it.
Anything that the government has not been in a denial mode, and we have never denied anything. There is oxygen we required, but again, there is, you must understand, for example, people do talk about beds. I'm not saying what they talk about, beds are in shortage. Yes, they are in shortage, but if you look on a larger picture, if the number of beds in Uttar Pradesh, please look at, we have L1, 1,15,000, we have L2 and L3, which means oxygen beds, oxygenated beds we have is about 65,000. The number of patients which are active and in the hospital are not more than 40,000. So when you have these figures, but what happens is if something, the number of beds have gone up in Noida with requirement. So you don't have so many beds when you plan for the entire...
People are running, people are running even now. Sir, you just don't have the number of beds to keep up with the demand. Every hour I'm getting calls from people in Noida, people in Ghaziabad, people in Meerut looking for beds. I mean, it seems that your system is overwhelmed.
Well, if you cannot understand...
I'm not minimizing it, but it's a huge challenge.
I'm not making you understand. It's not a question. So if the cases go exponentially higher, if you have created between COVID-1 and COVID-2, 3 times more L2 and L3 beds, but a city sees a surge, you don't create for the city like that. You create, okay, how many beds you would need extra. For example, today, we are adding in each city or each district 200 beds immediately, adding up to be almost about 15,000 beds in 75 districts and 18,000 more beds. That is 33,000 will be added in the next 15 days, which will be oxygenated. Now, if those 200 beds which are added, the number of patients come out to be 800 or 900, obviously there is a crisis there. So the only way is we reduce, we do more testing. Now we are doing almost 3 lakh testing per day, increase more testing, and also bring the number of cases down. So number of cases down in Uttar Pradesh for last 5 days is almost about 30,000. Today is 90,000 from a peak of 37 to 38,000. So if we are able to maintain that, and the recovery is about 37 to 38,000 recovered patients are there. If we can maintain this, then obviously there is a decline or southward movement. So all these things need to be addressed holistically and look at it holistically.
I'm glad though that you've come and told us that you are now preparing for this on a war footing. That's reassuring to note, because Uttar Pradesh, as I said at the outset, is India's most populous state. To that extent, the challenge there will remain the greatest. Sidharth Nath Singh, appreciate you joining me here on the news today to tell us what you claim the UP government intends to do. The ground reality though remains very, very troubling.